diving into our conversation, we're just going to make sure that our live video is working. So if you are tuning in, if you want to give us a thumbs up or something to let us know that you can see and hear us, that would be great. This morning, we're going to be talking about COVID-19 and kids. There's been a lot of stuff we've been seeing in the news lately, and we just want to get to the bottom of it with Dr. Alter for parents. So just give us a second while we make sure that everything is working okay here. Okay, looks like we are good to go. So, Dr. Alter, thanks for being with us this morning. So let's just dive in to the question that's probably on every parent's mind is, should they be more worried now that they're seeing this stuff that's out there? What's new, I guess, with kids, and should parents be worried?
I think, overall, I just try to reassure parents that so far COVID-19 seems to be relatively uncommon in children. And in many children that are getting it, they have mild illness, and many of them are probably showing no symptoms at all. We wouldn't know whether they're infected or not. So, I'll reassure all of you, including myself with my grandchildren, that it's primarily a milder illness. Now, having said that, I think as the weeks and months go by, we learn more about the infection, and we are seeing uncommon or rare infections and complications in some children that have coronavirus infection.
Okay. And so what is this? And we have this here called this mystery illness that seems to be related to kids and COVID-19. What is it? What are we seeing? How many kids has it been seen in?
Sure. We know that, to answer your question, Grace, that in adults, we know that many of them have a very marked inflammatory response. The body's trying to get rid of the infection. And in adults, we're seeing some issues with that. But we have seen in the last 3+ weeks or so in Europe, Britain, in New York City, and now spreading, I watched the news last night, they said 17 states in the United States, a condition that's a little bit different. Okay. It looks again like these children are having an inflammatory response where they have a number of findings, including a rash, a red skin rash. Sometimes the whites of their eyes may look a little bit red. Sometimes they're having abdominal pain or diarrhea. Importantly, they're having fever, and the fever lasts for a few days. They may have some trouble breathing, or they may not. The child may seem a little bit sleepier than usual. And sometimes you'll see other things, like their lips may be red, their tongue may be red, or their hands may look red and swollen. Many of these kids look like conditions that we've known about. For example, one that I'm sure people have heard is called Kawasaki Disease. In Kawasaki Disease, we've seen since the 70s, the late 60s and 70s. We don't know the cause, but they kind of have this inflammatory response as well. We know how to treat them. And even Kawasaki disease and most kids that are having what we now call pediatric multisystem inflammatory syndrome, the Kawasaki-like disease illness, they tend to do fairly well. As far as the numbers, I think New York City is in the high 80s. Across the country so far, there's probably less than 200. So you need to put it in perspective. Coronavirus is uncommon so far in children, and we think it will stay that way, hopefully. And this is even less common. So the chances of a child getting it are fairly low, but one needs to be on the lookout for any child that has those symptoms.
Okay. So how does this compare to, if we think about something like the flu, with something like that, do we sometimes see like, okay, the majority might experience this, but in rare cases, maybe certain kids might experience other symptoms? Like, is that kind of what we're looking at here, that sometimes things present differently?
Yeah, I think, as this is a new infection, obviously, we are learning more and more as time goes by. Certain things, will arise that we didn't expect or didn't think would happen. With influenza, we kind of know that some children with influenza can have very serious disease. Most don't. I mean, they're obviously sick, but they can have other problems as well. It's similar to flu that, most kids have common flu and can be fairly ill, but get better. There can be an occasional complication with influenza as well. I think the difference is this is such a new infection with such a new viral agent. We're just sort of going on and learning as time goes on. But again, I think, Grace, we need to emphasize that so far this is very uncommon in children.
Right, right. And we have a lot of people joining us right now. So if you have specific questions for Dr. Alter related to COVID or COVID in kids, feel free to type them in the questions and we'll answer them. We know that there is a lot of information circulating out there, and this is your chance to ask our community expert on this, which I know as a mom, I love to be able to do. So please type those in the comments if you have specific questions. And as Dr. Alter was saying, we just want to continue to reassure parents that this is still uncommon in kids and is, greatly not impacting them. So let's talk a little bit. We had a question from mom earlier, kind of about the ages that are being impacted. Is it showing up in newborns? There's a lot of parents I know having kids right now. It's scary having a baby right now. I have a 4-month-old myself. Let's talk about newborns and infants.
I think, the coronavirus causing COVID-19 can infect any age. Again, to reassure people that, like I would never want a kid to get the flu. When a child gets the flu, they're sick, but they get better. And that's what we're seeing. Right. Having said that, there are some serious reports of illness from around the world in children. Again, relatively uncommon. As far as newborns, that's even less common. There have been some reports of the disease in newborns, kids under the age of 1 or 6 months. And for example, many of these kids don't even present with respiratory lung disease, which is what we tend to expect in other individuals, older individuals. So while most can be fairly benign, there are some infections that have resulted in serious disease in children. But again, these are very, very uncommon. And let the people know, we have not here at Dayton Children seen any children that are seriously ill with this infection. We've not seen any of them that have had this Kawasaki-like disease either.
Yeah. So let's talk a little bit about, because I know we're getting a lot of questions here about schools and daycares and all that stuff. And obviously, I know, Dr. Alter, you're working very closely with the Ohio Department of Health and whatnot. I know people are anxious to hear what the governor is going to say, but maybe just talk a little bit about, we keep hearing about kids, maybe they aren't experiencing the virus a lot, but they might be carriers. Can you speak to
that's part of
that a little bit?
Yeah, part of the issue. While we expect some kids to be sick, absolutely. A sort of more community-wide concern is that a child may be infected, and you've heard the word asymptomatic. So they have an infection. Yeah. Asymptomatic means they don't show symptoms. So therefore, I may not know that child is infected. And so if I interact with that child as an adult, particularly an adult who has risk factors for more serious disease, I could pick that up from the child. And so the idea of limiting infection in children is that we don't want them to get sick, obviously, but then they pose a risk to all of us potentially of getting infected. So yes, it's a very difficult issue about schools and then daycare. I totally understand that. And I think, we're waiting for more guidance with that. But it's going to be a tricky situation to get everybody back and try to still minimize the spread of the infection.
Yeah. We're getting a number of questions here just about, I'm going to put up a question here. Jillian says, what is your recommendation about play dates with other kids right now and on into the summer?
Well, I don't know. That's a tough question. I think that, my own grandchildren, I know that they've had a play date or two with some other kids. They know the family. They know that no one's ill. They still, while they have that, maximize the best they can with hand hygiene. Obviously, it's hard to keep kids apart with good cleaning before and after that they're there. I still think we have to, we have the sort of shelter in place, the 6-foot rule, and good hand hygiene. That still is very important. But, my own personal feeling is that a select family perhaps could be permitted on certain occasions. Again, when I visited kids, we've maintained the 6-foot social distancing the best we can, which means you haven't hugged anybody in a while. So it's right. And I think we have to listen to the experts. I occasionally worry that perhaps we are lifting the restrictions a little bit too quickly. But I'm waiting for more for smarter people to tell me about this, but I worry a little bit about it.
Well, and I think that, Dr. Alter, I've known you for a long time. I know that you are very knowledgeable on this stuff. And just to hear you talk about it, it just shows me, we are all learning about this every day. Everything is changing, and we're all just getting new information every day. And so that's what makes it hard. And I can hear that in your voice too.
Yeah, I mean, it makes it difficult. I had to spend some time a couple of weeks ago looking at the daycare center situation, and that's tough. I think we're going to hear perhaps some more information from the state, hopefully relatively soon. But I think it's tough. I know that it's tough, especially if people want to get back to work, back to the normal lives. If now we limit daycare, but I think we'll have more guidance in the near future about perhaps opening those up a little bit.
Yeah. So let's go to some more questions here. We have a few people talking about kind of high-risk kids, and so let's just go back to that. So Dara says, I have a child who was born 25 weeks. She'll be 2 in August, has BPD, and has been off oxygen for almost a year. Would she still be considered high risk?
I think that is considered high risk. I mean, let me see. I'm sorry. I should say, how old is she now? Oh, she's going to be 2. I'm sorry.
2.
She was younger than that. I mean, it sounds like she's improving. I mean, and we know that happens with kids that have a chronic lung disease or what's called BPD after being premature. So if she is off oxygen, off therapy, sometimes there are other medicines, and has not had many issues, I think she obviously is at less risk than if she were 6 months of age and still perhaps requiring oxygen and other medications. So I believe that, whether I consider her high risk, she may be a tiny bit at high risk, but I believe that it sounds like she's getting better, and she's probably close to the risk of any child that would be 2 years old.
Okay. So then we talked, I'm going to put this question up here, but a few weeks ago, you and I talked about kids and masks. So if you have more questions about kids and masks, you can go, well, we talked about masks in general, but we did talk about kids. You can go find that interview. But this person, Bridget, is specifically asking about special needs kids and masks. And I would say that this is a good question, not just for coming to Dayton Children's, but just in general. So do you want to kind of address that issue? Because I know a lot of parents are concerned.
Yeah, that's very tough. I don't know the best answer for that. Sometimes occupational therapy people and speech therapy people and those individuals, PT, would have better suggestions. I think that everything we do in medicine is risk versus benefit. And, if there is a major risk in harming the care of this child by forcing a mask on them, then I don't think that can be done. Now, a little bit about mask in public.
Yeah.
The idea of all the face coverings that we're having is not necessarily to prevent me from getting infected. While there may be a little bit of that, the real reason we wear it is if I'm infected, to prevent me from infecting you. It's common sense. And if everybody wears it, then we all protect each other. So I think that, a child that is having major issues, much as we would love that patient to wear a mask, I don't think that it is a major breach in care if the child doesn't wear a mask. I just think that you can just get to a point where, if the child's not going to wear it, they're not going to wear it. But again, I may not be offering the best answer. There may be some other people that have alternative ways that we could get the child to wear it. But I think that in public, I think I wouldn't, go to an extreme hassle in forcing a child to wear a mask. And also remember that under the age of 2 years, it's not recommended to put a mask on a child. We don't do that. And we also, just as an FYI, we don't put mask on individuals that can't take them off, so a handicap patient, if you put a mask on them and for whatever reason you weren't there and they cannot take the mask off, then I would advise not wearing a mask. So there are some conditions where we don't wear masks.
And I'm going to put in the comment here our blog about kids and masks, so that the families can read that as well if they have more questions. So this is a good question, because I know that I've seen some stuff in the news of people being that now it's saying, oh, maybe this was actually here in December or January or whatnot. And I know that, we don't know this kid's case, so we can't say for sure. But Holly's saying, my son was in the hospital in January with pneumonia and flu. Could it have been coronavirus?
You know, it's hard to tell. It's the same with a lot of individuals. I have a relative that was quite sick in January, coughing for a long time, was concerned that she might have it, and was actually tested for the antibody. It was negative. It was not that. So, you know, I mean, that's part of it's part of the thought about getting a reliable antibody test would be to check a person like this at some point. We don't have that yet. And obviously it's not going to change anything. And, you know, even the question of if that particular patient did have coronavirus, does the antibody actually mean you're immune? I'm sure people have read that you're not going to get an infection. We don't even know that yet. I mean, so that's a tough question. I mean, you know, could it be back in January coronavirus? Who knows? You know, I tried to remember in my mind dates when all this started. And the date, for example, that they closed the market in Wuhan, China, was actually New Year's Day. So you get a sense, you know, and the first cases were not in the United States till, you know, a little bit after that. So we don't think it was readily circulating in the fall. You could even argue maybe in early January, but who knows? And I think, you know, if we have a more reliable antibody test, which is the blood test, right, not the swab, and in the future, you know, I think it'd be interesting to see how many of us have been infected, particularly children who, unlike, may not even be that ill. So that's a very hard question to ask. So could the child have had coronavirus? You know, I think it's possible. I think it's less likely, but it's possible.
Are we seeing like people with it, even just adults, like having both COVID and the flu or COVID and pneumonia? Like, are we seeing that together? Absolutely.
I mean, early on in the pandemic, many people were saying, well, if you get infected with coronavirus, which is a virus, that you don't have other germs at the same time. That's been shown that that's not true. One can have, the fancy word is polymicrobial. You could have more than one germ in you at the same time. It happens with flu sometimes. It happens with other cold viruses that if you look hard enough, you find more than one germ. So there is a percentage of individuals that have both the coronavirus and another germ. And, you know, how does that contribute to the severity of illness? I think we're still looking at that. But yes, absolutely. You can have more than one germ.
Okay. So here's a question from Dustin. You were talking about antibodies. He wants to know, how long do the antibodies last in our system?
That's an excellent question with a tough answer. I mean, you have to look, if I forget about coronavirus and look historically, if I had chickenpox, which I did when I was a young child, and I test me for antibodies against that virus, the varicella virus that causes chickenpox, I should still have antibodies in me. And, you know, I'm 60 years out, you know, and so there are some other antibodies, like, for example, to flu, that unfortunately, if you get it 1 year and you make an antibody against that virus, may not protect you against the virus the next year. The virus may have changed a little bit. The whole concept of vaccines is we try to encourage / fool the immune system to think that they're infected by the real germ. They make antibodies. And so when they meet the real germ, like measles, for example, if I have the measles vaccine, I already have antibodies years later to protect me. So I think most antibodies, we hope, will last your lifetime. We know some don't, they get lower. We have no concept really to give 100% answer about, you know, the darn COVID-19 virus, the coronavirus. And that's the issue. I think we're all hoping that if you're infected, you have antibodies and, you know, you're not going to get it again. We just don't know that yet.
Right.
We don't know that yet.
Yeah, it's just too soon.
The whole idea of antibodies, once you have it, you're thought to be immune. But there's a little question mark.
Yeah. So we hope that that's the case, right?
Right.
Okay. So next question is from Brandy. She says, I would like to know if cancer kids are more susceptible as other children or the same. I've read conflicting studies saying that they are higher risk, but another study says they're seeing no difference in risk with healthy kids.
Yeah, I mean, that's actually another very good question, because I've been looking at some information of infections in kids. There's a recent article that did find that the severe illness in the population, and it wasn't large numbers, it was less than 100, but there was more severe illness with kids with underlying conditions. And there were a variety of things. from congenital immune deficiencies to being on certain medicines that compromise your immunity, to actually there were some kids that had cancer that were at higher risk as well. So again, I think an adult with cancer, we consider high risk for coronavirus.
Yeah.
Now, if I find, I'll comment on the question, which is another good question. The first part says, are they more susceptible? That means, are they more likely to pick up the infection than somebody that doesn't have cancer? And I think the answer there is probably not. I mean, all of us are at risk of picking up the infection. The real question is the second part of this individual question, is that what happens if they pick it up? And I think that a child that's cancer, especially if a child who's currently receiving chemotherapy, for example, I believe they probably are at risk for more severe disease than a child who's not. I don't necessarily think they are at higher risk of picking it up. At least we don't have evidence for that. But if, God forbid, if the patient got it, they might have a little bit more severe illness, or they may not. But I think they're probably a little higher risk for more severe illness.
Okay. So then another one, Sheila says, my 11-year-old son has asthma and seasonal allergies. Any recommendations? And I will say, I'm going to throw a blog in here as well that we did early on with Dr. Evans in our pulmonary department about asthma. But I don't know if you want to touch on that as well.
I think the seasonal allergies is probably not an increased risk. I mean, I have seasonal allergies. I don't think that I would be at increased risk for more severe illness. Asthma, I mean, yes, I think if you have underlying respiratory disease, I don't think that makes you at increased risk to pick it up again. But if a child with asthma picks up coronavirus, I think there could be a chance that patient might have a more severe coronavirus than not, and the child may not. For example, some kids, and it's uncommon, some kids may be on steroids for asthma. Steroids would suppress you, that you could get a more severe coronavirus infection. But I think a well-controlled child with asthma hopefully is only at minimal increased risk for severe disease, but I believe they are.
Okay. So then Anna wants to know, is COVID-19 affecting children's hearts? And maybe you could discuss, are we seeing heart conditions in adults, since there isn't a ton with kids, but either one.
Yes. I mean, you are seeing, there's a few things you're seeing in adults. Adults are having heart problems. Some of them are having heart infections, like myocarditis. Others, I think adults may be at risk because they have underlying coronary artery disease, and they could have a problem as well. Now, this question here particularly pertains to this newer illness that we're seeing, the pediatric multisystem inflammatory syndrome. And I'm glad this was asked, because I didn't address that early on. If you look at Kawasaki disease, which is somewhat similar to this with a little question mark, the worst thing that can happen with Kawasaki disease is that they have involvement of their heart. And I know that some of the kids that are having this new syndrome do have heart involvement. Now, I think the good news is that even with those kids that had it, most of them seem to be improving. So I think coronavirus infection is unlikely to infect your heart. But if you're very ill, particularly if you're ill with this new syndrome, again, very uncommon, very rare, there are some children that have heart problems with that. And luckily, most of them seem to be getting through with the care that we're offering. We've seen that with kids with Kawasaki disease too. And so I think the best answer to that is COVID-19, the coronavirus, unlikely to infect your heart, but in some kids with serious disease, it could. Same with adults.
Okay. Let's see some more questions that we're getting here. We appreciate everyone sending in these really great questions. Definitely ones that I wouldn't have just thought of. So these are great. Let's talk about, because someone's asking more about the symptoms again. So Morgan says, can the symptoms be going limp, blue lips, and a rash all over, and no fever? So do you just want to go over what the symptoms of this new pediatric thing are again? And they are in the blog that's listed at the top of this broadcast. You can click on that and see them for those who are watching.
I mean, I think those symptoms, I would be concerned no matter what. I don't remember exactly what they were, but it was a limp child. I can find
that. Going limp, blue lips, and a rash.
Yes, I would be concerned with that. And I think that that would prompt a call to your practitioner, your provider. Absolutely. Now, with the new syndrome, you could have that as well. But one of the hallmarks seems to be that you're having fever with that. You know, and many times the fever can be up to 4 or 5 days or greater. So, you know, regardless of fever, if a child had those, I would contact someone, your doctor, your pediatric provider, to find out what's going on here and whether or not you should be seen in the office or limp. Those are some concerning presentations there. The classic, again, I'll call it PIMS, but it's pediatric multisystem inflammatory syndrome that we're seeing. Almost always they have fever, okay, along with a rash. They may have difficulty breathing, and the rash may be reddish blue in color. Sometimes the whites of their eyes are red. Sometimes they have mouth changes that look red. They could have abdominal pain with that, swelling of their hands and feet. So that whole constellation would make me think of that. But the symptoms that your person just sent in, I'd be concerned regardless of what's going on.
Okay. And I'm going to paste,
Grace,
go ahead.
Grace, is that we still see the common things, you know, and, you know, that can happen to children. And so, you know, I think that you have to be diligent for other things as well. You know, we know that, you know, a question that's been coming up in adults sometimes is, where are all the other conditions that we normally see? You know, people are hesitant sometimes to call their doctor or whatever, but I think that even a parent needs to be concerned or diligent that your child can still pick up things that are not COVID-19. So, you know, if a child looks sick in any way, and you're concerned, you should ask for help.
And do you just want to touch on that for a second? I know that some parents are concerned about if their child is sick or injured about going to the hospital or going to the doctor. And do you just want to touch on that it is safe to go to those places?
Yeah, I mean, I've done infectious disease for almost 40 years, and I've been impressed with the level of infection control, sanitation, adherence to masks and using gloves and gowns. That is occurring not only in the hospitals, but also in offices.
Right.
I mean, you know, by limiting the number of children that they may see, by using all of this stuff in their own offices, you know, obviously the use of virtual visits and telemedicine prevents you from going. But I feel very confident that the practices are doing what they need to do. And again, everything is risk versus benefit. If a child is quite ill and needs to be seen, they need to be seen. But you know, from what my interaction has been with the docs that I know in the community, they're all doing a very good job in trying to prevent any spread. And you know, offices, hospitals, emergency departments, I think are safe if you need to go there. I think I have no concern with that.
Yeah. And I just put a blog in the comments about how Dayton Children's is specifically keeping families safe. So if you have questions about that, you can look at that and review all those. But I think that's really important. Let's see, I'm going back through some of these comments here. Okay, so Katie is asking, and I assume she's talking specifically about this kind of new PIMS thing. So have there been any cases locally in Ohio? So that's the first question. And then she wants to talk about diabetes. So let's answer her first question. Have there been any cases of the PIMS locally?
I have heard that there's a case up in Cleveland of a child that has.
Okay.
I know that there was one in Kentucky that was on a ventilator, a child with that. Beyond that, I mean, there have been some questionnaires out to some of our children's hospitals. No one else has seen it as of my knowledge yesterday. No one else has had any other cases. I think we're all preparing, and I think we're well prepared. We have a group getting together, and we know what we need to do. So there have not been a lot of those cases at all in the country. They're pretty uncommon, but I believe there's only been one in Ohio as of yesterday. The second question is diabetes. Now, that's a very good question, because when you look at the risk factors in adults and looked at severe illness in adults, and an adult's not a child, one of the risk factors has been diabetes, severe illness. And so I think by default, we're also including children with diabetes as potentially higher risk for having severe disease. And again, I would not say that they're high risk of picking it up, but if they had the infection, they might be at higher risk of potentially having a more severe disease than they've not had diabetes. We've seen it in adults. There have not been that many cases in children that we can definitively say that it is, but by just looking at the infection in older individuals, it appears that diabetes probably has a little bit higher risk. It's been the same with
Is,
influenza. We know kids with diabetes are at higher risk for bad flu. Or they're a target group. Obviously, everyone's a target group of vaccination, but we know that diabetic children, we have to keep an eye on them too.
is there a difference between type 1 and type 2 diabetes in this case?
I think it probably isn't. It probably isn't. I mean, yes, there's a difference in the disease and why they have type 1 versus type 2, but the bottom line is they both have diabetes. So that, I would consider a diabetic child at perhaps a little bit higher risk of having a more severe disease if they contracted the coronavirus infection.
Okay. We've had a few questions here about how it's affecting children with a higher BMI.
That's interesting. And again, realizing that the numbers in children are very small, and I think as time goes by, we'll hear more. I mean, for example, if you look at the literature that's been published in medical journals, if you have 100 cases of children, that's considered a good number. Whereas you can read an article on adults and there'll be 5,000 cases. I mean, so the numbers are still small. If I may, if you go back to the H1N1 epidemic, the swine flu back in 2009, we found out that with influenza, individuals with a higher BMI had a worse outcome with flu, and they were considered a high-risk group. I think there's some information on adults again, not if there's some in children, I haven't really seen it, but in adults, individuals with a higher BMI tend to have a higher risk for more severe illness. And so that's been seen also with coronavirus in adults. But as far as a child, I think it's so uncommon. I mean, the number of cases of severe illness are so uncommon. It's hard to comment on that. Should they be considered higher risk? I don't know, maybe perhaps a little bit higher risk for a more serious illness. But I'm saying that simply, again, just looking at the adult data, which may not be pertinent to a child. I think one of the differences, and most parents realize that, and that's what I enjoy being with pediatricians, is that most kids don't have a lot of other existing comorbidities.
Right.
They're not older, they don't have heart disease, they don't have diabetes and high blood pressure on top of that. And I've seen kids with some bad illnesses, with underlying illnesses, pick up an infection and they do well. So I think that's the nice thing I've always liked about children is, yes, they could be sick, but most pull through it relatively well.
Yeah. We have another question just about kind of people who are allowed at Dayton Children's right now, visitors, vendors, that kind of stuff. And maybe you could just touch on, once again, some of those restrictions that we're doing with visitors and what we're doing with everyone that's coming in to make sure that everyone's safe. Right.
I mean, I do know, and you can correct me too, Grace, we're in a period where we're reassessing our visitation policy. But right now, up till now, we've had for inpatients and in the ER, in the inpatients, one parent with a child. We're trying to limit the individuals come. Right now, we're also looking at whether that could be increased to 2 parents, for example, with a child that's admitted to the hospital or going to surgery or in the process of flux. We don't really let much other people that don't need to be in here come in, which means, unfortunately, siblings, we minimize that to the risk of them and perhaps the risk to other individuals. We don't let other people that don't have specific business in the hospital come in. We screen all visitors and employees. I'm screened every day. Do I have a temperature? Do I have symptoms? So, we have actually cut back on the number of people that are working in the hospital right now, and that may be increasing soon as well. So I think, we don't want to have unfortunately, a lot of the traffic that we used to in this current environment. But and again, I don't want to give the wrong recommendation, because I know that right now we're reassessing our visitation policy a little bit as things are, kind of opening up a little bit.
Right. And if you have questions, if you want to keep up with our latest, childrensdayton.org/coronavirus is where we are continually updating that. And then our Facebook page is also a great way to continue. So for those who are watching, you're already there. Okay, let's see. What about children with autism? Are they considered high risk?
I don't think that they're considered much at higher risk than a child who doesn't have autism. I mean, honestly, most kids with autism do not have an underlying immunologic disorder. They, as long as they don't have underlying other heart conditions, diabetes, chronic kidney disease, lung. I think that they're at no more risk for a severe coronavirus infection than a child who might not have autism.
Okay. We talked about allergy a little bit earlier, but this person specifically asking if my child takes allergy medicine, is he going to be more susceptible?
I think he'll be not. I'm assuming the allergy medicine is probably for congestion and seasonal allergies. I have not seen anything that has said that worsens the infection at all. We don't want the child to get it in the first place, but I don't think that he's at higher risk or at risk of having a more severe disease. Thank God.
Okay. This is a great question, something that I have wondered as well, since I have a 4-month-old. What about babies and young children who are now living in a, quote, bubble? Can we expect their immune systems to be weaker?
You know, that's a well thought out question. You know, we know that, especially over the last couple of decades or so, that, you know, there is a benefit for kids to get some infections early on, particularly very young infants and toddlers. You know, kids that go to daycare pick up infections, but as they get older, they have less infections. And so I don't think we know the answer to that. There's enough, you know, even in your home, in your lockdown, there's enough bacteria, for example, around your home, even the cleanest home, let's say, that we all have germs in us. And most of the time, those germs don't do anything. They're part of what we call your microbiome. And so even an infant who's kept at home is going to be colonized with some of those germs, which are beneficial at times. So that that is an excellent question. I think my own answer is I think child will be as fine as if we were not, unfortunately, locked down or in a bubble. But I could be wrong. I don't think I'm wrong. I think the child will do fine because there's enough exposure to other germs and viruses that are not pathogens, things that are going to make you deathly ill, that they should stimulate your immune system the way it's supposed to. So, I mean, by truly living in a bubble at home, you know, yes, you want to keep it as clean as you can, as sanitized as you can, but there's things in our home too that aren't going to hurt you, and in reality could probably help you. We need to have a healthy microbiome.
Yeah. Okay. So Amy has asked, and I'm going to put it up here. She's asking us to address kids who are struggling with anxiety and depression related to this. And I'm putting this up here because I am going to do another Facebook Live actually later this afternoon with one of our psychologists about mental health in kids. So I know that that's not your area of expertise. So I think you would probably defer to Dr. DeWitt, who I'm going to talk to later today.
Yeah, absolutely. I mean, there is a lot written about this, not only for kids, but for adults as well. And I'm glad we're doing that because she'll have the answers to that. I think there are some resources available also online. If I may, Grace, I'm a big fan of the American Academy of Pediatrics information site where you can gain information on a lot of things. It's healthychildren.org, and not only on coronavirus, but a bunch of things. And I did see some information on this sort of a topic there as well. I'm sure later on she'll have more resources, but yes, it's a problem, and I will defer to the physician later on to give you a better answer than that.
Yes, so I wanted to put that up there to kind of give a plug for that we are going to be talking about that. And we do have some blogs as well. So, okay, so we are getting a question about our new surgery protocol that is required. We are going to be testing kids before surgery. So do you want to just touch on that about why are we testing kids as opposed to just screening?
You know, all hospitals, and I think I'm mostly correct by saying all in the country, as we open up to more elective procedures that we've been deferring for the last 2 months, are requiring coronavirus testing. We are asking all children within 48 hours of the procedure to have the swab done to see whether or not there is coronavirus present. You know, we've started that this week, and we will continue that, as are everywhere else. The idea is to see why would we want to know that? It may not necessarily defer surgery if it's critical, obviously, but if it could, that would be a possibility. The other thing is that if we know that a child may be infected, we might use different personal protective equipment during that surgical procedure than if we did not know that. So it's for the safety of the child, for the safety of the staff that we do that. It's a swab. It's relatively benign, the swab, and we want to make sure within a couple of days we get that and we know the results. Now, if a child came in,
and I did put a link.
Go ahead.
I was just gonna say, I put a link in the comments about our kind of process and some FAQs for parents to read. So
perfect.
Go ahead.
I mean, obviously, if a child came in, seriously ill, let's say in a trauma, and we needed surgery and we could not get the results stat, we would still go to surgery. Okay, if there is a urgent, very urgent or emergent need for surgery, no one's going to say, well, we better hold off until we get it. No, we would do that. So if we have the time and opportunity to do testing, we will, for the reasons that I said earlier.
Okay. So we touched on this a little bit earlier, but let's just touch on it again. And I did put a link in the comments about kids and masks, so you can look for that. But Katie wants to know again, just what is your opinion about a child wearing a mask? Is it beneficial? She's heard lots of things. So let's just talk again about what the goal of wearing a mask is.
Yeah, I mean, I think that all of us get this sense that we're protected if we wear a mask from getting an infection, a facial covering. I think that we don't think that that's 100% true, that you're still at risk. But if you wear a mask, you are at less risk of transmitting it to another individual. So it makes sense then, if we all wore masks, then we would protect each other because we're not transmitting it. So that is the face coverings. That's predominantly the reason. Now, in the hospital, sometimes we wear masks that are a little bit more efficient. I'm sure you've read, not to use masks like this because we could run out. This, I think, perhaps affords a little bit better protection, but probably not much, to be honest. I think it's good. But outside, the idea is to protect other individuals. As far as coming into the hospital, we give masks to everyone that comes in for that reason as well. And they would wear masks similar to this. I think that honestly, we have seen little confirmed coronavirus infections. And of the ones that we've confirmed, I don't know the exact percent, but a good percent were outpatients. They weren't even in the hospital.
Okay.
And so that, do we have individuals with circulating coronavirus in the hospital as you walk around? I tend to think we don't. Okay. And so I think the risk in a hospital coming in our hospital is still very low. I think we're doing the best we can to protect our patients and their families as well as their staff. And, again, masks are a good idea as far as transmitting the infection. Do they afford a little protection? Yeah, perhaps a little bit.
Okay. And I was going to ask about that because we have had a few people asking about our local cases of kids with COVID, to which you just kind of answered that it really has been a low number. Most have been an outpatient where they've been sent back home. If we do have someone that has to be hospitalized, we have protocols in place, right? So do you want to talk about those a little bit, just so that people know what we're doing if someone is suspected?
We designated one of the floors on our hospital as a COVID unit to a degree. That we have special rooms there. For example, if I had a coronavirus infection, you ideally put me in a room where we call it a negative pressure room. What happens is that the pressure in the room is less than the hall, so air is sucked in rather than spewed out into the hall. We make sure that everyone uses the necessary protective equipment, including family, the parent that may be there. And so our idea is to not have a patient somewhere else in the hospital. Now, could you have a patient admitted that is picked up somewhere else? Yeah. But again, I think that even if we suspect coronavirus and we don't have the test back yet, we're going to do everything we can to protect the patient, protect the employees, and make sure other individuals don't get it. So, if you, Grace, if you look at pediatric testing in Ohio, and this is data from around yesterday or so, of all the kids that have been tested, I believe that it's around only 2% are positive, which is very similar to ours. We may actually have less than 2%, and I don't know the total N, the denominator of the number, but it's a few hundred kids that we've tested. It's a little, excuse me, a little less than 2% of the kids have been infected. So, it's still fairly, it's very uncommon. And again, most of those are out.
Which is good. Yeah. So my last question, unless we get any others in the comments, we got a question in our parent Facebook group, which if you are not a part of that, you can join that. It's called Dayton Children's Parent Partner Insiders, and that's a way you can connect with us as well. But she was asking about daycares, but specifically, potentially looking at alternate options. So would an in-home, maybe smaller daycare be preferred to a center, or is the risk really going to end up being the same because anytime you're going to put a group of kids together,
I think your latter comment is probably the correct one. I know that one of the things the state has, and we've worked with our daycare center here on, is we have a center here at the hospital that the hospital runs, is that Ohio has sort of mandated that the ratio of caretaker to child is 1 to 6. Many people now, infants need perhaps more than that. Obviously, they need more care. Most daycares around the United States, it's 1 to 10. It places a hardship as to how many kids you could get. So 1 adult supervisor or caretaker for 6 kids. And so I think we're waiting to see whether or not that'll be modified. So, if you have, 3 kids at home and you're taking care of them versus 6 kids in a room, I think you're exactly right. And I've heard this from our daycare center personnel. Kids are kids, and they tend to congregate, they tend to grab toys, they tend to share. So, I think you still do the best you can. I don't necessarily think that the risk in one area versus another, home care versus a bigger childcare center, I don't know if anybody's actually looked at that. It's just difficult. And I will add, one of the concerns, and I think parents know this, is that kids tend to be asymptomatic, which is a real hassle, because you may have 8 kids in a daycare center. They all look great, but one child is shedding the virus. And if that child grabs your toy and you're not careful with your cleaning, and another child grabs it and does, this, there's a potential for spread. But I think that could happen at home too, unfortunately.
Right. Absolutely. And in any scenario where there's lots of kids together, I mean, you can't really keep, I have a 19-month-old, you can't really keep them from sharing and not putting it in their mouth. I mean, it's just unrealistic. So we have a question from Liz. She's wanting to know how it might affect children with severe CP. So her son's 4, non-mobile, non-verbal. How concerned should she be if he gets it? She's saying that people in her house are being treated and she has symptoms. So it sounds like she's, extra concerned about her special needs child.
We know that, and again, if I go back to the H1N1 epidemic of flu a few years ago, and no, this isn't influenza, but we did realize that some handicapped children can have problems handling the flu. And I think it comes down to what is the respiratory ability of the child. Many kids with, we'll use the letter CP.
Yeah. She says that he's had multiple previous pneumonias and using chest clearance.
Yeah. So he obviously has underlying respiratory concerns. And I think that, yes, that would potentially pose him at risk for more severe disease if he were to acquire it. I think, again, it's critical to, divide susceptibility with severity of illness. Is the child more susceptible to picking it up? I don't think so, than if he didn't have CP. But if the child did pick it up with his chronic lung disease, he is at risk of having a more severe coronavirus infection. Can you predict that with 100% certainty? No. I've seen some kids that have underlying disease that you think things and read about them, and they do fine. But a straightforward answer is that child would be at, I believe, higher risk of having a more severe COVID-19 infection.
Okay. And we did get a few more questions about our visitor restrictions. Again, I just put the current ones in the comments there so you can review those. We are reviewing those regularly as hospital leadership, and anytime we update those, we will share that on our Facebook page and on our website. But they currently are the same of what they have been, and you can review those on our website. So if you have questions about that. So I'm not seeing any more questions coming in right now. So Dr. Alter, is there anything else that you want to, let's just, since this was originally about kind of the new symptoms, I'm just going to end with, should parents be worried about the new things that we're hearing?
I think everything that I've read, the first point is that it's very rare. And I think we could go through the entire pandemic in Dayton and not see a child. On the other hand, we could, and that's why you have to we are prepared for it. But I think that if you have a child that has a fever, 4 days or more, let's say, and develops a rash or red eyes, looks ill, not eating well, sleepier, you should contact your doctor. I think, that could be other things as well, but could it be the pediatric multisystem inflammatory syndrome? That is in the differential diagnosis. And so, yes, if your child has that, contact your provider. Do I think that's going to happen frequently? Absolutely not. But that doesn't mean it's zero. So just keep alert for that. I don't think it's going to happen. Be wary of it.
Okay, great. Well, Dr. Alter, thank you so much for joining in. Thank you, everyone who joined in and asked questions. These were really great questions. We will come back with you again as new things surface, and we really appreciate it. So have a good day.
Thank you.